In 2022, we're going to go over 8 billion for people on the earth. And so during the course of a human being's lifespan, 1/3 of us will develop some type of cancer. And certain ethnic groups will have a proclivity to develop certain types of cancers. Black men, not just Black American men, but men of African heritage have a higher rate of developing prostate cancer, and they're more likely to succumb to it. The key to any cancer, whether it's prostate cancer or breast cancer or any types of cancer, to the extent that you can, you want to detect it in its infancy. That is, you want to detect it as early as possible. That is the equalizer. And what I mean by that, if you detect cancer early, your chance of outcome of being cured with that cancer is just as high as your white counterpart. Problem with African American men, if you will, one is a social economic issue, lack of health care, or they have access to poor quality health care, or both. So if you don't have access to good health care, you're going to present with more advanced cancers, and the outcome is not going to be as good. So one is a social economic issue. The other is some genetic predisposition. For example, if you have a father, an uncle, or brother with prostate cancer, irrespective of ethnicity, it increases your rate by twofold. As an ethnic group, we're at increased risk. We need to be aware and start getting screened early, because that early detection translates into saving lives. So if you don't have access to health care, and you're not going to go to your primary care physician, and you're only going to go when you feel something or you start feeling symptoms, then there will be that disparity in mortality, whether you're Black or white. The most common symptoms of prostate cancer could be no symptom at all. However, symptoms of prostate cancer can mimic a benign condition called an enlarged prostate. For example, urgency of urination, frequency of urination, getting up at night when you were not getting up before to urinate once, twice, or 3 times, pain of any sort in the pelvic area, sexual dysfunction in younger men could be a symptom. But I caution men, more and more men are presenting without any symptoms. The only way that we're able to detect the cancer is that they have gone to their primary care physician for their annual physical exam, and part of that exam is to do a very simple blood test. Very simple. It's called a PSA, prostate specific antigen. That test should be done on every single African American man or men of African heritage starting at age 40. It should start at age 40 and annually thereafterwards. Every year you should be screened. And let me just say, in addition to the PSA screening, also be examined. They should have a physical exam concurrently with the PSA, and there's a specific reason for that. The PSA is a very good test, but it's not a perfect test. That is to say, you can have a false negative PSA in about 18% of the time. Almost 1 out of 5 men could have prostate cancer, but for whatever reason, that cancer is not producing PSA. And the only way you can detect it is by examining the prostate. So you should do both. Well, I'm an oncologist, so by definition, I see men who've already been diagnosed with prostate cancer. So, for example, say John Smith is 42 years old and he goes to his primary care physician and she does an exam and she also checks his PSA and his PSA is elevated. The first thing she's going to do with that is probably recheck it to make certain it's not a falsely elevated test. And if it's truly elevated, she's going to send him to a urologist. The urologist will first do an exam, check the prostate to see if there's any abnormalities. And if the PSA is truly elevated, they may want to do an ultrasound of the prostate and do a biopsy to determine whether or not that elevated PSA is related to cancer or other benign processes. If it's prostate cancer, from the biopsy, once the pathologist has read it, then the patient will see me, because I only see patients who have been diagnosed with prostate cancer. But once they get to me, my job is once again ask about family history. Are there any other men in the family, males in the family? Talk to them about the importance of screening, and then come up with a strategy in terms of how to treat the prostate cancer, for which there's a whole host of options. I'm just one of those options, along with surgery, along with other options. But we all work as a team. It's a multidisciplinary approach. So once I see the patient, I go back to the urologist. We come up with a plan in terms of how to treat.